The federal government is being sued for $1.5 million by a Navy man named Peter Riviera. He underwent a thyroid removal surgery because of thyroid cancer in a hospital in Guam. But when the results came back, there was no cancer. 3 decades ago, thyroid cancer was diagnosed when the thyroid gland was so enlarged that a doctor could see it. But now, more than ever, people are being diagnosed with thyroid cancer, and most remove the entire thyroid in response. So why do people remove their thyroid, and what are the consequences of it?
This is the Happy Moto Show.
Hi, this is the Happy Moto channel, and on this channel I talk about health-related topics. I was super excited today to feature my cat in her new cat bed, but she doesn't like it. If you like this video, please like it so other people can find it, and let me know your thoughts in the comments below. On this channel, I talk about the thyroid a lot. It's a tiny gland in the front of your neck that influences the endocrine system, ruling the hormones. 150,000 thyroid removal surgeries are performed each year. From 2006 to 2011, the rate of thyroid removal jumped 30%, and that's a big jump. Only about 2 of the people diagnosed with thyroid cancer will die from thyroid cancer. The most common reason to remove the thyroid is nodules or the presence of tumors in the thyroid gland. Another obvious reason to remove the thyroid is thyroid cancer, but there are a lot of medical reasons given for removing the thyroid. First one being stress. Excessive amounts of stress can be damaging to the thyroid, especially if you have an underperforming thyroid. Imbalance causes your metabolism to slow down, weight gain to occur, insulin resistance, blood sugar spikes, and slowed down or halted thyroid function. The second reason is diseases, like autoimmune diseases affecting the thyroid. That could be Graves' or Hashimoto's disease. But removing the thyroid for one of these conditions does not cure the condition. It might make it more manageable. A third reason given for thyroid removal would be inflammation. And that's common with autoimmune diseases as it causes the entire body to become inflamed. Inflammation can be expressed by sore muscles or getting easily injured during exercise. So if the thyroid is chronically inflamed, then a lot of the body is going to become chronically inflamed. This is a key aspect of a lot of autoimmune diseases. And this inflammation can trigger cortisol production, the stress hormone. The fourth reason given for thyroid removal is toxins. There are 2 common toxins that are found to be dangerous to the thyroid, being polybrominated diphenyl or polychlorinated biphenyl, better known as PBDE or PCB. There are other toxins that could be affecting the thyroid, but as a rule, it's good to avoid any product you don't know what the ingredient is inside. And the 5th reason for thyroid removal is over or under doses of vitamins. Now, it's important to know a lot of autoimmune diseases can cause deficiencies in key vitamins like vitamin D, and in some cases, the lack of nutrition can lead to these chronic diseases. I don't have any proof behind that, someone else said it. So now we know a few of the reasons given for removing the thyroid, and some of those don't seem so extreme, like over or And some of those seem a bit extreme, as you can treat someone underdosed in vitamins. You simply supplement, or you can handle stress by creating better systems to mitigate those stresses. So what happens when a thyroid is removed? What are the consequences? Well, you're now hypothyroid. Once the thyroid is removed, you're no longer producing thyroid hormones. So removing the thyroid can be considered a cure for hyperthyroidism. That's an overactive thyroid. But you've effectively traded hyperthyroidism with hypothyroidism. This means that you are reliant on thyroid hormone replacement medications for the rest of your life. A second result of removing your thyroid is lower T3 levels. When you have your thyroid removed, you're put on medication, either synthroid or levothyroxine. Both of these medications have the key thyroid hormone T4, thyroxine. But what you probably don't know is T4 is not active in the body. And studies show that the thyroid never reaches normal levels of T4 with medication alone. So the solution is medications that have the active T3 hormone with the inactive T4. are more thyroid, has both of them, but not every medical doctor is going to know this. And a lot of people struggle with thyroid hormone supplementation, getting the right dosage because they simply are not able to get the right dosage without T3. Another consequence of removing your thyroid is weight loss will be difficult for the rest of your life. Medical studies show 80% of people who have had their thyroid removed struggle with weight loss, and the average amount gained after thyroid removal is 15 to 20 pounds. And it gets worse when you realize some people gain more weight than that. It is said that people who gain weight after thyroid removal are not getting enough treatment, but the thyroid hormone does control the metabolism, and once you're hypothyroid, you will struggle with losing weight for, the rest of your life. A fourth consequence of removing your thyroid is that you will have to continually supplement yourself and the thyroid. So remember that I told you doctors often prescribe one medication and that medication does not have active T4 levels? Well, guess what activates it? Zinc and selenium. And if you haven't heard me the entire time, the fifth consequence of removing your thyroid is that you will be dependent on medication and the medical system for the rest of your life. We need the thyroid hormone in our body, and without the thyroid, how are we going to get the hormone? Well, it's going to be through medication or supplementation, and that can get expensive over time. There are alternatives to find cheaper medication, but you should be aware that you will most likely need health insurance and these medications for the rest of your life. And these surgeries sound kind of traumatic. I mean, you're going to be stuck on medication for the rest of your life, struggle with weight gain for the rest of your life, and the thyroid affects our mental health. A lot of people with thyroid autoimmune conditions report struggles with depression, and you're certainly going to have those struggles as well if you remove the thyroid. If you have a thyroid condition and are considering removing your thyroid, some of this information can be overwhelming. Even with new methods, it is a delicate surgery, even with new methods. So are there any negative consequences to removing the thyroid? Well, yeah. First one being hospital readmission. There was a study in 2014 where nationwide readmission data was gathered on nearly 23,000 thyroid removal patients. The treatment was done to cure cancer, remove goiters, or manage an overactive thyroid. In all, 4% were rehospitalized within 30 days. Most of these patients were readmitted within a week for follow-up surgery. Of the patients that needed readmission, 25% returned within 2 days, researchers found. The researchers found that those at the highest risk of being hospitalized were those on Medicare or Medicaid. Patients on Medicare or Medicaid could find it financially or logistically difficult to obtain the treatment before the symptoms begin to worsen. Also, at risk were patients with low calcium levels before the surgery, and those who remained in the hospital 1 to 2 days after the surgery. A second result of removing your thyroid is altered brain function. According to a study in May 2018 publicized in the magazine Thyroid, patients with acute hypothyroidism following total thyroidectomy, I can't say that very well, have increased local brain function connectivity, which correlates with poorer mental quality of life and depression. These findings confirm the concern that thyroid withdrawal has an acute influence on brain function, which mediates negative psychological effects of thyroid hormone withdrawal in patients with total thyroid removal. The study involved 21 patients who underwent total thyroid removal for thyroid cancer. Before and 2 weeks after thyroid hormone withdrawal, the patients were assessed. Thyroid hormone withdrawal was linked to increased REHO or REHO in primary motor and sensory, visual, and association cortexes. These areas are correlated with lower mental component summary and severe levels of depression. Some endocrinologists may minimize the psychological complaints and slight IQ drops of patients, just as long as they seem to be functioning normally. However, thyroid hormone withdrawal is acute and transitory, according to professionals. A third result of removing your thyroid is going to be eye problems. Now, I have no medical study to back this up, but you can go onto a lot of thyroid related message boards and you will see a lot of people complaining about eye issues, including blurry vision, dry or swollen eyes. Thyroid conditions are strongly related with dry eye, and removing the thyroid can inhibit the body's ability to produce tears that regulate dry eye. Thyroid eye disease could be a result of thyroid removal. The symptoms that occur in thyroid eye disease include dry eyes, watery eyes, red eyes, bulging eyes, a stare, double vision, difficulty closing the eyes, and problems with vision. Thyroid eye disease can affect different parts of the eye or the surrounding tissue. The treatment for thyroid eye disease include medication, radiation, or surgery, and a combination of these may be needed to protect the vision. One of the more rare complications of thyroid removal is thyroid storm. What is thyroid storm? It is a rare but potentially life-threatening complication resulted from hyperthyroidism. That's hyper as in overactive. It is characterized by high fever, fast and often irregular heartbeat, elevated blood pressure, vomiting, diarrhea, and agitation. Hypertension with a mute pulse pressure occurs in early to mid-crisis, with hypotension accompanying shock occurring in the later stages. Heart failure and heart attacks may occur. Death may occur despite treatment. Oh, that's stressful. Medications to block the overproduction of the thyroid hormone, called beta blockers, are used to block the overactive thyroid hormone. All of these consequences are minimal according to research, but things to be considered. The thyroid must be removed to prevent the thyroid cancer from spreading to other parts of the body. But the margin of human error provides the opportunity for some thyroid hormone removal surgeries to be performed when they are not necessary, just as Peter Riviera, the person suing the federal government. And it's not hard to find someone who removed their thyroid and years later question if it was worth it or having slight regret. And that makes sense. Removing your thyroid puts you on medication for the rest of your life, and it does not relieve the patient of hypo or hyperthyroidism. And most patients with thyroid conditions do not report feeling completely normal even with medication. So if you are facing the choice of a thyroid removal surgery, this video is for you. Let me know in the comments your thoughts and what you're thinking, how you want to move forward. Have you heard of someone that has regretted to remove their thyroid, or am I overreacting? It's a completely safe and normal surgery. Let me know in the comments below. Like this video so other people like you can find it, and subscribe if you want to hear more topics like this. Thanks for watching my video. I'm sorry my cat wasn't here for it, but I'll try to get her in the next one.